Yeah, so how's the week been? You feeling much better? You were meant to be in Palestine right now.
Actually, we were supposed to be going, my wife and I were supposed to be going to Palestine next week, but unfortunately they've decided that they're not sending any healthcare workers from South Africa at the moment, so we're just on standby.
So you're still on standby?
Yeah, but we'll see how it goes. We're not actually going to Palestine. We're planning to go to the Rafah border crossing.
Right.
And, there's refugee camps there, and we're expecting a lot of refugees to be coming through from Gaza there. So that's where we're supposed to be.
Excellent. If you have any questions, send us a message right now, 060-904-1056. Hafiza says, Assalamu alaikum, hope you're well. I'd like to wish my sister-in-law, Salma Basha, a very happy birthday. May all your dreams come true by the mercy of Allah. May success follow you in whatever you do in life, with lots of love from her mum, that's Safiya Sayed, her brothers Aslam, Salim, nephew Hussein, niece Husna, and sister-in-law Hafiza Sayed of Hilltop in Verulam. Jazakallah. Assalamu alaikum wa rahmatullahi wa barakatuh. Why don't we have more Hitlers around? Hitler should have burnt all the Jews. Oh, okay. No, this is... I don't know, man. Lung lupus patient, leg pain, taking Valhet and Cataflam. Every night. What else can be done?
Depends on how old the patient is and when were they diagnosed with the lupus. But usually the specialist will adjust dosages and give the treatment according to the stage and whether it's in relapse or not.
So here's a message, Doc, that says, Salams, I have perianal abscess.
Abscess, abscess.
Oh, it says access here. Okay, but abscess.
Okay.
Abscess. Should I have it drained or do I leave it to disappear on its own? It happens often.
It won't disappear on its own. That's the unfortunate thing about a perianal abscess. So this is an abscess that is very close to the anal opening. And usually what tends to happen is if it's left over a long period of time, it develops into a fistula. And a fistula is an open track of, in the flesh, which your stools and all of that get collected in there and causes sepsis, and so you don't want to end up with a fistula. So I would recommend that they go in and have the abscess sorted out. Okay, it's a very painful condition, a very uncomfortable condition as well, and it's something that people think, if they just put their pants on, it'll go away, but they need to have it sorted out. Yeah.
Zakaria knows all about this.
I can see Zakaria's laughing a lot there.
And he's shaking his head. He's like, yes. You experienced it, Zakaria?
No, just imagining.
Oh, you're just imagining. Okay. Salams, hope you're well. I'd like to know more about gallstones. Is there any non-surgical way to treat gallstones? Also, what surgery options are there? Does the whole gallbladder have to be removed? Any side effects post-gallbladder removal? Maaf for so many questions. Jazakallah in advance from Aisha.
Okay, so gallstones, we talk about all the Fs, it must be a fat, fertile female of 40. Right, those are the 4 Fs for gallstones, right? Fat,
fertile,
female 40. Right. So if that's usually when we see the gallstones are most prominent. Usually presents with the pain in the right hypochondrium or just under the rib, the last rib on the right hand side, and it's a very sharp pain, and it's also associated most times with vomiting. So these are actually stones that are in the gallbladder. Now the gallbladder is a small little like a balloon which holds the bile.
Okay.
So bile is injected into the small intestine, and that's there to help with digestion. Right. But what tends to happen is at this age in females, they develop what is known as gallstones, or this bile becomes crystallized and forms a stone. So there's no way to take them, to dissolve them, or there's no way to take any medication to get rid of them. So usually we just it's not a big operation like it used to be. Basically it's done endoscopically, where they make 2 small holes in the abdomen and then a third hole for insufflation, and then they just snip it out. They take the whole gallbladder out. So it's nothing serious. It's an overnight thing.
Okay. A question here says, what causes anal abscess?
Many causes of anal abscess. Usually, like I say, you get, I've discussed the most common abscesses we find are because of ingrown hairs. So most of the body where skin is against skin, you'll find that you develop what is known as a thickening of the skin, and when the hair tries to come out, it cannot, and it goes back in and forms an abscess. So especially in this area as well, it's very common to get ingrown hairs, and then you develop an abscess. You also, due to the location of where it is, if you're suffering from piles, if you had what is known as an anal fissure. A fissure is something that develops, when you don't drink enough water on a very hot day, you become a bit dehydrated, and then the stools become very hard, and when you go to the toilet you push, and you stretch the anus and you tear it.
Okay.
And that causes a longitudinal fissure, and that fissure can also cause those problems. So these are all very painful and uncomfortable positions, and I can see Zakaria this time is not smiling, he's flinching.
Yeah.
So you know about this one, huh?
He knows about that.
Yeah, I know when you ask the patient, when you want to find out whether it's a fissure or whether it's actually piles that's troubling them, when they have the fissure, they have the sudden feeling like they want to hide themselves after they go to the toilet. So they want to hide behind a curtain. They don't want to be with people. They want to be away. That's a psychological. It's a mind. It's a instinctive thing that a person wants to do because the pain and discomfort is so bad, and basically that's the primitive instincts of wanting to be away from people or anything so that they can be in a safe place. So yeah, so it's a very uncomfortable thing. So that's usually. There are many different other causes, but I won't go into all of them. But the bottom line is, if you do have it, you need to go and have it sorted out.
Safiya says salams for him, listening after a while. Just a shout out to my son Abdus and daughter Hannah. Jazakallah for a lovely show. Absolute pleasure. Keep on listening to us. Jazakallah, this is from Razia Suleiman. Jazakallah for an awesome program. And I have to say that every Thursday when Dr. Bhayat comes on, just listening to him, we feel good immediately.
Oh, alhamdulillah.
He is down to earth. He is a down to earth doctor and comical as Fahima and Kelly. She says, calls me Fahima. That's funny as well.
No, I think she said Fahim and Kelly are. So I think she just put that. She got excited. Yeah.
Keep it up, team. Wassalam. Shukran. Jazakallah Razia Suleiman. And the name is Fahim, not Fahima.
But when you wear that beanie, it's hard to say. You know what I mean? When I look from the window across there, sometimes it can be mistaken.
How can you be
Fahima,
mistaken? Can you see this facial hair?
No, probably when I look from that window across from a distance.
You're not sure whether it's Fahim or Fahima?
Yeah, Fahim or Fahima.
Yeah, you think I'm pretty, though?
You're pretty boy, yeah.
Assalamu alaikum. I have these painful spasms in my arm, side of my lungs. How do you sort this out? Just uncomfortable and sore.
Okay, so you see the most common muscle that gets caught is the one that starts. If you feel the back of your head, you'll feel two protuberances there. That's your occipital protuberances. That's where the muscle attaches, and this is the rhomboid muscle. So it's shaped in such a way that it starts there, it goes onto your back, and then it has fleshy attachments onto your ribs, and then it's like a puri, that shape, two triangles there.
Oh yeah.
So usually the top part, usually caused by tension, or when you're in the cold for too long, or if you're driving with the window open. So what tends to happen is that muscle goes into spasm, and whenever something goes into spasm, don't massage it. You keep it warm, cover it and keep it warm. When you start massaging it, then the rest of the muscle starts going into spasm. That's where you'll find a person who starts off with a small pain in the neck or back of the head. They think they can massage it away, and the next day when they wake up, more of their back is painful. And where the lung comes in and the side of the chest comes in is because of these fleshy attachments I told you to the ribs. So every time you take a deep breath in, you're stretching that muscle, and when you're releasing the breath, it's going into spasm again. So you get a very sharp pain that whenever you take a deep breath in.
Okay. Assalamu alaikum, Doc. I run often and to keep fit. Recently, after long runs, I get a slight pain behind my knee on the right side. It pains mostly when squatting or standing after sitting. I'm 28 years old. It goes away when I take a break from running and comes back when I start again.
Yeah, that's a classic thing that you see in runners. It's ligament damage. You see, there are a lot of rubber bands or ligaments and tendons as well that on keeping that whole joint connected, because it's a very important weight-bearing joint. So whenever sometimes if your shoes, they say you shouldn't do more than 500 kilometers or 600 kilometers with your running shoe. If your shoes are out of balance, if the heel or something is not right with it, then what tends to happen is you start to put strain on different muscles and tendons in your knee, and that's when the strain starts. So as soon as you start feeling a strain in your knee, you need to check your shoes first, and then you should stop for a day or two. You should wear a knee brace to stabilize the joint. And if you continue to run with that pain, eventually it leads to more serious tendon damage, and then you got to stop running for around about 6 weeks. I had a similar injury about 4 months ago, and I had to stop for about 4 weeks before it came right.
Salams Doc, hope you're well. I'm 67 years old, very well. Need to know what vitamins I can take after breakfast. Also had my womb out about 9 years ago.
Well, basically, you just, I keep telling everyone that the best thing to take is cod liver oil. Take your Scots emulsion, 1 tablespoon every morning. There are a lot of trace elements that are needed in people who are over the age of 60. But there's a whole range of multivitamins that you find that range from 20 Rand to about 400 Rand. Basically, all are the same. Just the branding and the packaging is different. So any multivitamin will be fine. All these immune boosters and all these things that you see are not really, basically they're just a different combination of the same vitamins you'd find in a multivitamin. Maybe 1 or 2 tweaks here with the amount of with the quantity of it, but basically if you take I always say that DS24 is one of the best, and it's moderately priced vitamins that a person can take.
Junaid, this is another Junaid who says, Allah bless you all. You all are doing good work. Alhamdulillah, and Ameen for your dua. Salams Doc, at 64 years old, I'm pre-diabetic. What's your suggestion as far as treatment goes?
Well, 64 pre-diabetic, and if there's a history of diabetes in the family, then inevitably you will most probably get it. But after the age of 60, most people with the kind of lifestyle we lead do end up with type 2 diabetes, where they have to take oral hypoglycemic like metformin or something like that. But there's nothing to worry about. Just monitor the sugar, make sure that it doesn't go above 10 on more than 2 or 3 occasions. It's preferable to keep it between 3 and 7. So he should have regular checks every month. Go to a chemist, or if he's got a machine at home, he should check it. And if on 3 consecutive occasions he gets a reading over 10, then he needs to go and see his doctor.
Priyanka says, migraines. Summer is here and I get awful migraines. I eat well and drink 2 liters of water a day, but they just randomly hit like a bus. I try putting on the aircon or a wet towel on my head, but it just makes it worse. Accurate helps. I don't know what's Accurate. Accurate helps. But
Accurate is a tablet. It's a painkiller.
But I don't like taking pills.
Yeah, you see, there are a lot of triggers for migraines. Sometimes it's a sound that you hear, sometimes it's something you eat, sometimes it's a person that you see. It can happen. Lots of times when the husband goes home and then they get the migraine. You know what I mean?
Right.
So you get a lot of triggers.
Yeah.
Right. So you should identify what the trigger is for the migraine. Secondly,
if the trigger is the wife, then what do? You can't take Accurate.
No, then you get those dark sunglasses and you wear them at night, those Ray-Bans ones. When you wear lighties, you should get those dark
the
Ray-Bans.
black ones, yes.
Yeah, black ones. Yeah, you wear that, yeah. Just tell them no smash and grab things, you know what I mean? Yeah, so that you got to identify what your trigger is. For a lot of people, it's dairy products. For a lot of people, it's like flashing light on the TV or bright light that they suddenly see. And surprisingly, for some people, when they're walking out and then they get a little drizzle and their hair gets wet a little bit.
Right.
And then after about half an hour, they end up with a migraine as well. So there are a lot of different treatments at the moment that are available. Most of the people that suffer from migraines, they just take the normal over-the-counter medication and the lower schedule things like Mibulin and Norflex and things like that. But there are proper migraine treatments available, and they need to be assessed by their doctor, by their GP, and he can prescribe that for them.
What's the best medicine for postnasal drip? I have mucus buildup at the back of my throat. Feels like a blockage, especially when sleeping.
A postnasal drip, at the moment, previously we've had the treatment for postnasal drip Well, first let me explain what a postnasal drip is. It's basically mucus that drops at the back of the nose into the throat. It's usually caused by an allergic reaction or allergic rhinitis or a chronic sinusitis or infection. So before we had to use two different types of medicines. You got to take an antihistamine. A lot of people take it once a day, like cetirizine or things like that. And then they had to take a nasal spray or corticosteroid spray. So now they've combined both in a spray. I think I mentioned it before. It's called Ryaltris. It's a very good spray. You just one spray in each nostril in the morning and in the evening, and usually that takes care of the postnasal drip, allergic rhinitis, sinusitis, all the symptoms you have, hay fever. So it's a very good nasal spray that combines an antihistamine and a corticosteroid in one spray, which wasn't available before.
Green between the toes, what is it and how to get rid of it?
Depends where you've been walking. But usually green between the toes is a fungal infection. People who have a fungal infection or who wear boots and wear black socks, it usually leaves a green residue.
Okay.
Right? But it's difficult to say what the green is, but in most cases it's a fungal infection that causes discoloration.
Salams doc, I'm having a problem with my left elbow. It's very painful. Can't pick up anything heavy, affecting my whole hand. I do a lot of rolling because I'm doing savory orders all the time for Hana Shali.
I would recommend that she gets a brace for herself, elbow brace, and when she's not using that hand, she should get a strapping and put it around her neck and around her wrist so that she's keeping the elbow in a position where it's bent, in front of the chest like that, so that it relieves the pressure on the elbow. But she should have an x-ray done and find out what's the problem there.
Rehana says, salams for him. I second what the caller said earlier. Doc sounds so humble and with a nice sense of humor.
Jazakallah.
That's where we shall wrap it up. Doc, contact details for you.
It's 063 27 000 38.
Salams doc, Fahim and Kelly, is it okay to take both B-Cal DM and Osteo-Ease daily? Jazakallah doc for your valuable advice. May Allah reward you abundantly. Last question.
Yeah, no, if it works for you, then use it. Basically, those are also supplements, calcium and vitamin D and things like that for the bones and to prevent osteoporosis. So, yeah, they should continue with it if it works for them.
Jazakallah doc, thank you very much. We'll talk to you again next week, inshallah.
Inshallah.
Have a good week.